You know, mesquite plant is very useful plant and Mexican natural medicine. Um, it has lots of virtues. We recognize mesquite as a food in the first place. The mesquite vines is food for Mexican people. You can survive on mesquite. It's very, very rich in vitamins, essential vitamins like vitamin C, vitamin B, and also it has the protein, and it has the high content of sugar, so it will give you energy, it will give you a burst. That we recognize in creosote is like an antiseptic. It's very good as an antibiotic and also antifungal and antiviral medicine. I use it mostly externally. For example, a very common use for creosote is for diaper rash. When our little children have diaper rash, we don't use medicines. We don't go to the doctor for diaper rash. You know, we just bathe the child in creosote bathe, and we repeat the session for 2 or 3 days, and the diaper rash will be gone. When you had small gallbladder stones, you know, and or you just start with a diagnosis of or the gallstones, you use Brickellia. It has the reputation that it can diminish the size of the calculus or even help you to expel them by keeping the flow of bile constant. You will not have concentrations of bile sitting in your gallbladder.
The goal of this project is to train students. And we do that by teaching them how to go through the scientific principles in identifying whether there's a chemistry in a plant extract that can cause or be responsible for a particular biomedical event, killing a microbe, reducing the growth rate of a cancer cell, altering the ion potentials of some membrane, for example. Those would be the types of assays that we can conduct. Those are also the direct effects of drugs in a body. There's a big jump between doing those assays and using the material as a drug. And that's the strength and power of our drug companies in the developing world, in the developed world, I should say. My goal is not to discover any new drugs. My goal is to train scientists who can go out and do that.
Most of our anti-cancer drugs, or at least many of them, are derived from natural sources, plants and microorganisms. So over the millennia that evolution has worked on these sources, they have developed very sophisticated pathways to produce small molecules, what we know as drugs. And that evolutionary process has yielded things that are very specific in their action. What we're trying to do is to discover whether that specificity is useful in the treatment of cancer.